for a real treat this afternoon for our community spotlight. So we had an opportunity to hear from Samantha yesterday. And I can tell you from our board, there was a lot of amazement just on what happened in Southeast San Diego, as well as the work that was done, because a lot of that was unknown. So I think as you hear Samantha's comments today, you will have the same appreciation that our board had. But with that, I'm going to go ahead and call up Lindsay Wade, who will do the formal introduction.
All right. Thank you, guys. Thank you for being here. Welcome. Good afternoon. I'm Lindsay Wade with the Hospital Association of San Diego and Imperial Counties, and it is my pleasure to introduce Samantha. Samantha Williams is the co-founder and executive director of JIREH Providers. She's a family nurse practitioner with over 20 years of nursing and public health experience. In the height of the pandemic, Samantha transitioned from doing direct patient care to investing 100% of her time, providing care from within the community, health advocacy, education, and health. In 2021, Samantha co-founded JIREH Providers, a nonprofit mobile community health clinic. Through collective impact with community partners, JIREH leadership has provided direct access to preventative care services to over 50,000 San Diego County residents. In January of last year, catastrophic floods devastated thousands of San Diego residents, especially those in southeastern San Diego, South San Diego, National City, and Spring Valley. Samantha and the team at JIREH Providers were there and continue to be on the front lines of their response, supporting flood survivors who continue to struggle to meet their basic health and social needs. Thank you so much for being here.
Hello, everyone. As Lindsay said, my name is Samantha Williams. I'm a family nurse practitioner. Good to see you, Dan. And I'm also the co-founder and the CEO for JIREH Providers. JIREH stands for Joint Initiatives for Racial Equity in Health. And today I'll be presenting on reimagining community partnerships for impactful healthcare solutions while creating a vision for collaborative progress. I have a lot of information to get through today, so I am going to be speaking relatively fast. But I want to make sure, hopefully, that I'm able to really be a voice for the community that was impacted. So I do have one disclosure that I want to share. We are a CCP provider, which stands for Crisis Counseling. We did recently receive a contract with the Department of Healthcare Services. So that's the only thing I have to note today. And as you guys can see, that lovely lady at the top left is myself. Dr. Robert Gillespie is our medical director. He is a renowned cardiologist in our community. He's also a practicing provider with Sharp Healthcare for over 30 years. Jaleisha Smith-Jacobs is our chief nursing officer. She's a registered nurse and also the VP or AVP at Anthem Blue Cross. Dr. Susanna Flalo is a retired physician with Kaiser Permanente with over 25 years of practice and a dear mentor and friend of mine. Detlef Williams is our senior logistics director as well as a co-founder of JIREH and my better half. So most of you already know the health disparities and the problems that exist in our community, but for those of you who don't, I do want to just quickly share that communities of color are disproportionately affected by health disparities respective to burden of disease, hospitalization rates, and mortality rates. More specifically, the community that we target a lot of our services on, there are high rates of asthma, obesity, cancer, diabetes, and we know that these health conditions pose considerable threats to our communities. Additionally, those health disparities are further amplified by social determinants of health, such as poverty, lack of housing, lack of healthcare access, shortage of culturally appropriate healthcare providers, and a number of other different things. Also, it's important to note that in 2019, based on this research and information that was provided by the Public Health Statistics Unit with the County of San Diego, 7 out of 10 of the leading causes of death are chronic conditions. And so even though I'm going to get into this in a little bit, it's no surprise at all that those that were impacted by the flood definitely had a lot of these conditions, with top three of these leading causes of death being heart disease, cancer, and stroke. A lot of those health conditions were exacerbated by the flood. So one of our solutions and strategies, this is the thing that definitely makes us stick out, is that we are a mobile medical clinic. And not just any mobile medical clinic. We are one that is grassroots, authentic to the community. We definitely understand the significance of taking preventative health care to our community, creating that safe space for them to receive services. It's critical for us to develop our partnerships within the community and ensure that any provider practicing with us is a trusted, reputable provider in our community. We ensure that the education and screenings are targeted specific to those conditions. We focus on the 3-4-50 rule with the County of San Diego, focusing on those three behaviors specific to 4 health conditions that are impacting over 50% of the community. We also are known for our advocacy in the community in regard to equitable allocation of health resources. We did a lot of advocacy work during the pandemic. And of course, we're known for our community empowerment, just elevating the voices of our community and ensuring that we're supporting resilience and unity. So this is just a quick overview, and more so just to state that at the top of 2024 in January, we were on track to meet much of our projects and initiatives in the direction that we were moving forward. And then the flood happened. So here's a few pictures showcasing. There's no way, with all the pictures that I'll show today, there is no way that I would really be able to detail the impact that this had on our communities. So thousands of San Diegans, for January 2022, it was a life-altering day. And while for some, the floodwaters reached just below their roof, for many, the floodwaters completely covered their homes. For some, they just lost personal possessions. Others lost major possessions like their cars, while others lost their homes. Several other people also lost their lives that I'm aware of, because there wasn't a justifiable way of, or not way, the data was not tracked to really understand the depths of the devastation amongst the community. So that I'm aware of, there were 8 to 10 deaths in the community. However, there were also deaths that preceded the flood as well within the oncoming months. As a matter of fact, March of 2024, there was a young man who was 19 years old who had been grappling with depression, who ended his life. In April of 2024, and as a matter of fact, that was on Easter, at the Ramada Inn, where about 400 to 500 residents were being housed. There was a 62-year-old woman, and after failed numerous attempts of trying to obtain her prescription for asthma, she had been experiencing difficulty breathing, shortness of breath, and she passed because she didn't have her inhaler. So even though I kind of jumped into some of the devastation of the flood, I think it's really important that we talk about how we got here. And so I'm gonna try to get through this slide relatively quickly, but I wanna share some key points, and that is that in 2018, the city auditor raised the alarm about the deteriorating stormwater infrastructure, and that if the city of San Diego did not invest in that infrastructure, the storm channels would fail. In 2020, 68 channels were identified as high risk. Over 50% of those channels were in Southeast San Diego in districts 4, 8, and 9. In 2021, the city received those permits to do the work. In 2022, the city received a $733 million loan to begin that work. And in 2023, they published they published their work showcasing where that work had been completed. Unsurprisingly, none of the work had been completed in District 4. Very little of the work had been completed in District 8 and 9, and over 50% of the work had been completed in District 1, where some of the least identified risk was at. And so this is a slide really just showcasing exactly what I just shared. To your left is the work that was done to identify the channels initially in 2020, and then to your right is the work that the city published, the data. And as you can see, District 4 is in yellow, District 8 is in orange, District 9 is in red, and District 1 is purple. And so that was the district that received over 50% of the work. So again, this is just some of the pictures showcasing some of the devastation of the flood. You would think that because we're almost a year from the flood, that we are still not encountering people in homes like this. But even up until last week, we encountered a family that was sleeping on a mattress that was still 40 to 50% saturated in the storm drainage water, and her children have been sleeping on that mattress. We are still encountering homes where children and families are living with black mold. So now I'll speak a little bit about some of the services that we have provided thus far. I'll try to get through these slides relatively quickly as well because it's a lot of data. So we've been providing medical medical referral services. We were boots on the ground from day one, assisting with a lot of the navigation in terms of where some of the support was needed. Surprisingly, which I guess it really shouldn't be surprising to us, we were able to stand up a command center in the county of San Diego that was unmatched to any other command center. A few organizations like the Harvey Family Foundation, JIREH Providers, the Jackie Robinson YMCA, Urban Collaborative Project, and a few others that I won't name due to time. We organically came together as we were looking for solutions and trying to figure out ways to help folks. And so just initially within the first couple of weeks, we had already been able to encounter over 1,700 families through our canvassing efforts, provided over 250 health screenings. We had started assistance with pickup, delivery and pickup for prescriptions. Up until to date, we have had over 37 community health events. We are still meeting every single Monday with flood survivors, supporting their needs, and just continuing to make sure that they're up to date on resources. Next slide. We were able to bring on some disaster case managers, and up until date, those case managers have been able to complete over 50 home assessments. Through our canvassing efforts, over 2,000 assessments for social determinants of health. What else? We happen to have 3 chefs on the team. So to date, we have been able to provide 17,000 home cooked meals. You'll see a few pictures of that in a few. We happen to have a van. I think I have a picture of that later. And that van we have used to do a lot of our mobile transport for our donations and our supplies. We partnered with the County of San Diego to do a lot of the hotel visits. I'll get into this a little bit later, but I do want to just notate that with that emergency temporary lodging program, survivors were housed in over 66 different hotels, all the way from Chula Vista to Long Beach. And so that absolutely interrupted their daily lives, their work, and just their daily routine. So here's that picture of our van that I was talking about. And I don't have all of our team on here, but we do have 5 transporters that help to deliver a lot of the resource boxes in the homes and goods. We do this 3 days a week. We're talking about bedding, cleaning supplies, all kinds of resources. And so far, we have delivered these resources to over 500 families. This is just a small picture of some of the resources. And we know that by helping them in this way, it restores dignity, brings normalcy to families, reduces some of the financial burden, not much, but every little bit helps. And of course, it helps to continue to build trust within our community and just reinforce that we are here for them and they do have support. So again, these are just additional pictures of some of the flood devastation. These particular pictures you'll see later. There is a particular block that we focused, or we completed a 6-week pilot program for a community well-being event, and this is the block that was impacted. Additional muck out efforts are still continuing, pulling out drywall, pulling up flooring. We're still encountering homes that have not been touched. And we have an additional 5 team members that assist with the muck outs at least 2 to 3 times a week. So this is an example of that community well-being event that I mentioned. And even though I'll talk about this a little bit later, I'm really thankful that we were able to finally become a CCP provider. And then through that relationship with Cal Hope, they really have accepted our alternative way of providing crisis counseling. It's totally out of the tradition, but we use our community well-being events and our other encounters with our survivors to have those conversations about how they're doing and supply resources. Someone who's been impacted, walking up to them, handing them a flyer, asking them if they're okay is not the way that you provide that resource or that you initiate those services. And so we have found the way that we've done this to be truly successful. We make sure that our events are comprehensive with health screenings for diabetes and hypertension, care navigation resources, and many other services. And of course, we make sure that we have mental health services on the spot. Lindsay, how am I doing with time? Okay, thank you. I already mentioned that we're a CCP provider, so I'll go ahead and skip that slide. This is just some additional pictures of some of the work that is still continuing to be done. I'll dip in a little bit to some of the key challenges. Of course, survivors had challenges with seeking medical care. They were really worried about hospital bills, fear of retaliation, no clear guidance around the programs that were providing assistance. I talked about the daily disruption of their lives, especially being housed so far away. We saw lots of illnesses related to being in that contaminated water for days at a time, lots of rashes, upper respiratory infections. We had one gentleman that I was aware of that 2 weeks after the flood, he passed away from pneumonia. Lots of long-term health impacts related to PTSD and just exacerbation of those chronic health conditions. We also, one of the other nuances that we saw is that in March and April, we saw a huge uptick in COVID-19 positivity rates. Of course, we rushed in, we offered them our program, which was to see, as soon as they contacted us, we were able to connect them with the telehealth provider same day, pick up their prescription, deliver it to them, deliver them groceries as well as a COVID-19 care package that comes with a $50 DoorDash gift card, tea, cough drops, Kleenex, you name it, it's all in that care package. And then we went around to all the hotels staging masks, COVID-19 test kits, and a number of other resources and flyers. This is one of our testimonials, but since we're short on time, I'll zip past that. There definitely was an educational impact on the children, especially for those who were housed really far away. They weren't able to get to school. There were a number of children who were already on IEP plans. And of course, this raised significant legal and developmental and equity concerns. We're still working on, we're progressing through some of those challenges, but we're still working on a few of them. So of course, a lot of our smaller community organizations, they lacked access, such as JIREH, to funding that was allocated for the disaster. And so while some of our larger institutions were able to access that funding, there were concerns of misappropriation of funds and inefficient management. And I think that is key because a lot of organizations aren't always able to provide that culturally competent care, but those are the predominant organizations that are slated for the funding. So there's a lot of work that needs to be done there. Speaking of that, one organization in particular, which many of you may or may not know, is EQUIS, and they were the organization that did receive over $10 million to provide disaster case management and housing assistance. They failed miserably. It absolutely compounded the trauma that a lot of survivors had already experienced. The first month and a half that survivors were a part of their program, every 3 days they had to reserve their reservation, and there was a large percentage of them that on that third day, their reservation was not renewed, and they were homeless and lost to the system, and no one was tracking this data. So I stood with Monica Montgomery Stepp on October 21st to call for an audit of EQUIS, along with a few other organizations that have been committed to supporting flood survivors. Next slide. And so Also, some of the other challenges I want to highlight is that the relationships between hospitals and community organizations, they have to be authentic, they need to be equitable. I already mentioned that organizations like Equus, they tend to overshadow grassroots efforts, and it leaves gaps in the culturally competent care that is still needed to be provided. I think it's also important to note that there were grants and funds that were earmarked for the disaster that were missed due to underutilizing and just inaccessibility due to a lack of communication and coordination between hospitals, hospital associations, community organizations. So there's a lot of work that needs to be done there. I also want to mention that oftentimes when we think about FEMA coming in, we think of them as the cavalry, and that after they come in, everything must be okay. I think we know now that that is not the case. We still have survivors from Hurricane Katrina that are trying to recover. There are congressional hearings taking place now in regard to some of the services related to FEMA. But I want to quickly note that the application process is extremely difficult. The process itself added layers of trauma. It typically takes about 7 to 8 times to apply to even be approved, and many people give up before they get to that 7th or 8th time. And then even after being approved, the money that you're given is significantly less, and it's not enough that is needed to actually repair the costs to your home or if you lost a car. And so these factors have largely contributed to the numbers of survivors who now remain unhoused, are sleeping in cars, living in hotels, or on the street. So some of the proposed opportunities, just due to time, I'm going to skip past these because we talked a lot about these during the board meeting yesterday. I apologize. And in closing, just want to reiterate that this conversation underscores the importance of community-driven approaches in disaster recovery. We have a couple of events coming up. Most importantly is our December 14th event to support flood survivors during the holidays. And then in January, we will support them with a memorial event for the January flood. And for those who would like to support us, we are a 501c3 legitimately, and every dollar counts. I'm very honored to be able to speak here today. Thank you for your time.
So I just want to drive home one point. I mean, we're talking about flood victims and being out of their homes. In some cases, and Samantha shared yesterday, kids, some that happened in January, still sleeping on like wet mattresses. This is San Diego County. We have to be a little better than that. So, there's just opportunities. Remember when I started today, I talked about our why. We want to help people. There are opportunities, whether it's this, whether it's what's happening with the Tijuana River. These are just opportunities that we as a community have to come together and do better. So thank you for sharing that today.